clearly, you know, cancer surgeries, many of them have continued. We've talked about, you know, the 13,000 surgeries that have been done. There are ones that are very time sensitive, where we know there can be a dramatic decrease in either people's well-being or the increased in mortality if they don't get surgeries within a certain period of time. So obviously those ones are prioritized. We also need to prioritize by the use of critical care resources and making sure that we have the surge capacity in critical care should we start to see a surge in cases of COVID-19, because we know that that's really important for saving lives. So there is a balancing act, and there has been a lot of thought going into it. There are many types of conditions that can be optimally managed medically through a period of time before surgery is required. So there's that balancing of ensuring that we're doing optimal medical management for a number of people to be able to postpone that need for surgery for a longer period of time. And then, of course, there are the really important ones that people have been waiting for a long time, that are important for their quality of life, their ability to get around, and, you know, hips and knees being an important one of that. So I don't know, Minister Dix can talk a little bit more about it, but there is a plan.
And as I think you said before, Glenn, it's been led by Michael Marchbank, who is a former president of the Fraser Health Authority, a highly respected person in healthcare in BC. And there'll be a comprehensive plan, and of course we're not going to lay it out in bits and pieces, but we'll be presenting it and in detail to you in the coming days and weeks. And I think it's important that British Columbians who've had their surgery cancelled know that we've been thinking of them from the beginning, that this plan will obviously assess both our capacity in hospitals, our capacity in clinics that do surgeries as well, that all of which do day surgeries. In other words, it's all important surgeries, but do some of the less serious surgeries, because people do not stay overnight in private clinics that perform surgeries in the public healthcare system, for example. So it's a full assessment of our capacity, of our ongoing capacity to deal with COVID-19, the need to plan over a period of months, including into the fall, and the inevitable arrival of influenza season at the very least, and what we might plan into the fall. So that's the plan we're going to present, and it's important to note that we've done so many emergent and scheduled surgeries that are urgent. We said that those wouldn't be canceled. Obviously, surgeries that have to take place in 2 or 4 or 6 weeks still needed to take place, and we've done the surgeons and others and all the nurses and everyone in the healthcare system's done 14,597 of those. So you'll be expecting to see a plan soon, and that it will address all those issues, including issues around priority. I just want to say briefly on pharmacy. I want to say just a couple of more things, just to put it in context. One of the reasons why it was a challenge to go to 30-day refills that people thought about, and why we didn't do it as an absolute rule in BC, was because obviously people struggle going back and forth to the pharmacy more often, and this was a balance. And I want to thank everyone involved in pharmacy in BC for their ongoing work that they've been doing in the province over the last period. Just to put it in context, the number over the last month, the number of refills of over 70 days, so the long-term refills, dropped by about 6.7% in that time. So to put it in context, we would do about 700,000 of them, and about 50,000 or so of those, we did about 50,000 less than we usually do. So there was still a lot of refills of 70 days and above. But I do think the ongoing work of pharmacy and the ongoing work of pharmacare is really important. But that gives you a sense of how many people had their prescriptions filled for more than 70 days during the first month of the really intense period of the pandemic.